Chairman, I can confirm that the meeting is now live.
Thank you very much, Lizzie. Thank you. And good afternoon, everybody, and welcome to this meeting of the Bracknell Forest Local Outbreak Engagement Board. Thank you for your attendance. And first, if I could ask Lizzie if we have any apologies for absence, please.
I think there are apologies from Abby Thomas. I think that's the only apologies that I'm aware of. If anyone else has got any others, let me know.
Okay, thank you. If anybody does bring apologies.
Apologies from Kelly Williams also.
Okay, thank you, Charlotte. Thank you. Right, okay, and do we have any declarations of interest, please? No, then the usual caveat applies. Should anything crop up during the course of the meeting, please feel free to interrupt proceedings to make any declarations of interest that should become necessary. And Lizzie, do we have any urgent items of business, please?
No, none notified, Chair. Thank you.
None, fine. Okay. Then that takes us on to agenda item 4, which is the national and local COVID-19 status. And I think that's over to you, Charlotte.
Thank you, Chair. I'll just share my screen. Okay, is everybody able to see that?
Not yet, but it looks as it's coming.
It looks as though it's coming. It says Charlotte started screen sharing, but I'm
going to have a rerun of last week.
I think it's taking its time. It might be. Oh, here we are. Yep. Thank you, Charlotte. We've got it.
Okay, great. Okay, so first off, to just review the data and the statistics in terms of our situational awareness, you can see in the table presented, Bracknell Forest is the first line of the table. In the period between the 9th and the 16th of December, and this is in comparison to the previous 7 days. This is the data that we've currently got available to us in terms of complete data. There were 450 tests undertaken, the 7-day average per 100,000 population. That was an increase on the previous 7 days. And the number of positive tests over the total number of tests, so our positivity had gone up again to just below 12%. So again, an indication that community transmission is on the rise, as we know. Our cases, our weekly cases per 100,000 population had increased between that period to 300, just shy of 360 cases per 100,000, and actually today we have now exceeded 400 cases per 100,000. This is a 78% increase from last week, and actually a 206% increase from the previous week. So what we call the growth rate, how quickly the number of cases is increasing, is becoming steeper, and we'll see that in the next slide when I present the graphs. What's of particular concern at the moment that we're keeping an eye on is our cases in our vulnerable over 60 population. And previously, when I presented to the board, that was remaining low at around 60, 70 cases per 100,000. This has increased up to 170.7 cases per 100,000 of that population. And we are doing some further exploration of the data to understand where that's increasing. The over 60s is still a broad age group, so we're looking to see if that's within the community, which specific ages in the over 60 in 5-year age brackets it's occurring in, and whether any care home or hospital outbreaks are driving that increase further. Just to show that in that 7-day period, 441 new cases were confirmed. So when we look at the trajectories, Bracknell Forest being the graph in the top left, you can see that from the beginning of September through until the 14th of December, the period where it declines shows the effects of the national lockdown. And then for Bracknell Forest in the blue, since the end of November, we've been on a steep incline that's getting steeper as per our percentage increase over the previous previous fortnight. This is very much in line with the average of the southeast, which is in the orange, and actually what's looking to be the case right across the country with the England average in the grey. What you can also see was that the increases didn't happen quite so early as we've experienced in Bracknell. Actually, across all 6 local authorities, the increase in cases is now on the same trajectory as what we're experiencing. Now, as you will probably have heard, there is a new variant in terms of the virus. There's been a mutation that has occurred, and the briefings and the information that we've received is that that variant is more transmissible. What that means is it's easier to catch and it's easier to pass on. And whilst they are the UK is leading only behind Denmark in terms of our genomic testing to track these mutations. What we're looking at in terms of signals is significant changes in our increasing rates. And as you can see, it's quite clear right across the patch that that there has been a significant increase in the rate across all 6 local authorities. So we can assume that that new variant is circulating locally, as it is in most of the southeast and other areas of the country now as well. What that means in terms of action on the ground, nothing's changed. We're in tier 4. It's important to adhere to the tier 4 measures that are in place. It's important to stay home. This variant is extremely transmissible. It's easier to catch, it's easier to pass on. We should be treating everybody as if they have the virus and acting and behaving accordingly to minimize transmission. The evidence suggests at the moment that it doesn't cause more serious or severe illness. So it's all about how easily transmissible it is. We have looked at our breakdown of cases to understand where we need to target our efforts in terms of action and communication. And essentially, cases are increasing everywhere across Bracknell Forest. Between the 4th and the 17th of December, there were 690 new cases, up from 266 new cases in the 14 days prior to that. So again, supporting this sudden increase in the cases. Increase in cases is occurring across all ages and both genders, across all ethnicities and across all wards. We know that 52%, just over half of all our cases are associated with household clusters. However, 45% of cases aren't linked to household clusters, and it's these that we're interested in to understand where transmission is happening and how we target our efforts to stop that. We know from the national contact tracing and our local insight that 90% of contacts of cases are exposed within their own household. However, a number of cases were exposed through household visitors or through visiting friends and family. So again, we need to reiterate the importance of the new Tier 4 measures. Obviously, this is for the period up to the 17th of December, so before Tier 4 measures were implemented, but we will be looking at those exposures now that Tier 4 has been implemented to see if there are still individuals who are meeting with others outside of their household against the recommendations of the tiers. As I've mentioned, in terms of the new variant of the virus, at the moment, the evidence doesn't suggest it causes more severe illness and thus more mortality. And actually, our mortality data would support that. Thankfully, there haven't been any new deaths in the last week up until the 11th of December, which is where we have our data complete to. We've had 84 deaths to date, and whilst our excess mortality, that's mortality over and above what we would expect, is 10% higher across the entire course of the pandemic. At the moment, the grey line, which indicates the excess mortality, is in line with our observed mortality, what we are actually experiencing. So at the moment, the number of deaths in Bracknell Forest is as we would expect them to be, though we are going to be tracking this moving forward, because with the increase in cases, unfortunately, will result naturally in an increase in hospital admissions and demand on services, and unfortunately increase in deaths also. So as of the weekend, Bracknell Forest has now moved into Tier 4, which is stay at home. I've summarised the measures that are in place under a Tier 4 area. These have been communicated via a number of channels, and Elena will pick that up in the comms presentation next. Just to summarise, if you live in a Tier 4 area, you cannot join or form a Christmas bubble. And the main message is you must not leave or be outside of your home except for specific purposes that are noted. And we're familiar with those from other national lockdowns in terms of work, volunteering, essential activities, so essential shopping, medical attention, etc., and education and childcare services and support, as well as exercise and recreation, but only alone within your household or up to one other person. In terms of the other restrictions, as I'm sure you're all aware now, but just to summarise, bars, pubs and restaurants and hospitality more broadly is closed with the exception of takeaway, drive-through or delivery. Only essential shops are open, non-essential must close, but can open for click and collect and delivery. Everyone is advised to work from home unless you're unable to do so, and then there are guidance as to what you should do if that's the case. Education currently remains open, as well as childcare and childcare bubbles. Indoor leisure is closed, accommodation is closed. There is some exceptions, which again are clearly noted on the government's website. Personal care such as beauticians, hairdressers and the like, closed. Overnight stays is not permitted away from home. Again, limited exceptions do apply there. In terms of funerals, the guidance remains the same, up to 30 people are permitted, but wakes and other ceremonial events are only permitted up to 6 people, and weddings of up to 6 people can continue, but only in exceptional circumstances. Indoor entertainment is closed, and the vast majority of outdoor entertainment also closed. Some outdoor attractions can remain open. Communal worship and private prayer in places of worship is permitted, but only in your household or support bubble. In terms of travel, the advice is that you stay at home and only travel for work, education, or legally permitted reasons. If you do travel, you should stay local and reduce the number of journeys that you take. And you must not leave tier 4, stay overnight from home for any other reason. Residents in tiers 1 to 3 should not enter areas of tier 4, and you shouldn't travel abroad if you live in tier 4 unless exemptions apply. As I've mentioned, exercise is permitted and allowed to leave your home for exercise, but only with your household or support bubble or up to one other person. Residential care, you can visit relatives in care homes with COVID secure arrangements, and they're listed, and further guidance is available on that. And for our clinically extremely vulnerable individuals, they've been advised to stay at home as much as possible, with only going outside for exercise or for health appointments. And again, we've put support in place for those individuals that we can touch upon. I think Elena might be touching upon that, but if not, myself or Tim can brief you in terms of the action that's underway around that. So the headlines from the data are that exponential increase in cases is occurring across the entire community. Community transmission has now taken over from the outbreaks that we were experiencing in schools when I last presented the information to you. No new deaths has occurred in the last week, which is positive news, and excess mortality is in line with what's expected for this time of year. The new variant of virus seems to be circulating locally, and increased transmission is therefore occurring, but there's no evidence that it's causing more severe illness or mortality. In terms of our data analysis, and we've had an IMT, an incident management team, we'll be having these weekly meetings to review the increasing level of community transmission. That brings together Public Health England, our local subject matter experts in the local authority, and also our health colleagues and environmental health colleagues as well. Our actions for this next week will be to look at this increase in the over 60 cases to really explore what's driving that, and we can report that back in January. The local contact tracing offer, we have our local contact tracers working and covering throughout the Christmas period. The contact tracers are looking to explore, in addition to the contact tracing that they're undertaking, where individuals may have contracted the infection from, and that's to inform our local intelligence further so that we can target our communications and our enforcement approaches accordingly. In addition, we've worked up our contact tracing to support school outbreaks as and when they occur in the new year, and to support that outbreak management. In terms of enhanced testing, we're looking at our local testing offer that's currently being developed with plans to implement in the new year, and that includes the supporting the development of school testing, which is that national programme that's most recently been introduced. In terms of enforcement, we are looking to use the local insight and intelligence around what we term our common exposures, so that we can follow up with businesses or review our own directly provided or commissioned local authority services, and those that are flagging up as having or being associated with a high number of linked cases, we will be working with in a proactive way. Our COVID marshals that have been supporting the hands, face and space messages in and around our town centres have been redeployed out into parks and hotspots and other public spaces now that the town centres are largely closed due to the tier 4 restrictions. And we've had additional health and safety visits in schools prior to the end of term to support their COVID security and their risk assessments, and those will continue in the new year. I'm not going to talk too much about communications because Elena's got the next agenda item, but just to say we are looking at how we can best target communications, drawing on the intelligence that we know, and to simplify our messages, that COVID's everywhere. It's across all age groups, genders, ethnicities, and geographically across all wards, and that we need to be treating everyone as if they're COVID positive and behaving accordingly and within the tier restrictions. The message around stay at home is clear. It's not a request, it's a legal requirement. We're at the tipping point in terms of the increase in number of cases and the strain on our local authority and NHS services. It's not a time to bend the rules, and all individuals have an important role to play in limiting the transmission and reducing that spike that we're currently experiencing. And the final one, if you have symptoms and get tested, the importance of doing that in a timely fashion. And if you then need to or have been advised to self-isolate, then you need to do it. It's the only way to break transmission and to prevent outbreaks. And I'll leave it there and open it up to questions.
Thank you very much indeed, Charlotte. Thank you. Colleagues, are there any questions from members of the board? Mark Brunel-Walker.
Thank you for the excellent update and for all of the work that's going on right now at a time when normally we'd be quietening down for Christmas. So I appreciate everything that you're doing and everything that all of our colleagues are doing on behalf of residents. On the press conference today with Matt Hancock, mention was made of a South African variant, or at least one case that seems to have come from that. Given that we have a fair number of South Africans in Bracknell Forest in the immediate area, do we need to figure that into the messaging that we're putting out about the stay at home, you must isolate on your own? Do we have any more intelligence on that, or is it too early to tell how prevalent that might be?
Thanks. That's the first that I've picked up on it just before the conference. We've had a number of briefings around the variant, but there's been no mention to date of the South African variant. So it's something that I will seek to get some clarification on. My understanding is that the individuals who've experienced it have recently travelled, and therefore they are being isolated to prevent any onward spread. So what I read into that is that it's been brought in to the country as opposed to it being circulated. But I appreciate them. There may well, depending on the sort of travel behaviours of our local population, that may have implications. There are very clear travel restrictions that have been published off the back of that, so I think we can hammer that message home to everybody locally, and we can look to adapt our comms. But in terms of our approach locally and acting on that new variant, that's something that we would need to do some further exploration before we could make a judgment call on that.
Thanks, Charlotte.
Okay, thank you very much. Any other questions from board members? No. Okay, well, thank you very much indeed, Charlotte. That's great. That takes us on to the next item, which is the reports nationally and locally, and I think Elena was going to lead on that.
Thank you, Chair. Just bear with me 2 seconds while I try and share my screen.
Sure thing.
Can you see that?
Yes, we can.
Yep. Okay, fabulous. So I thought I would just give a very brief update on what we've been doing since Saturday, since the announcement that we were going into Tier 4. We didn't have any time, unfortunately, prior to the Prime Minister's announcement to prepare key messages or any assets or anything like that. So it was very much a very busy time on Saturday trying to get those messages out. We were working consistently on Saturday evening, and we had information available on our social media and digital channels. certainly within the first couple of hours after the announcement. We felt that was quite important because we could see from comments online that there was some uncertainty, and our residents, there was definitely a thirst for knowledge and a bit of community reassurance. So we made sure we got out quite quickly. Within the first 24 hours, across a number of posts, both organically and paid for, we had a reach of around 50,000 on social media, and we sent 26,000 emails on Saturday evening with an open rate of about 70%, which is for an external email. As I mentioned, website and our BFC intranet was updated, recognising that quite a number of our staff are local residents as well. And we sent a press release to the local media, which Councillor Bettison was quoted within, and that was sent on to our stakeholders for them to disseminate as well. We recognise that not everybody is on digital means. They don't always look at social media, they don't always have email. And specifically, our clinically extremely vulnerable people needed some extra information from us. So our partners at the ARC have been busy delivering around 1,800 leaflets over the past couple of days to get that tier 4 information out to those people. In addition to that, we have around 2,700 people on the clinically extremely vulnerable list who we have email addresses for, so we've been able to send them digital information with a click rate, an open rate, sorry, of about 67% at the moment. Our community information champions who are spreading up-to-date information for us were updated on Saturday evening as well. And our care providers have been sent information so that they can disseminate that to their residents and to their staff. We had planned a radio advert to launch today, actually, in fact, on Heart Radio, Heart Thames Valley, that is, across both the normal radio station and their digital channels, advising on Christmas bubbles, but we pulled that on Saturday evening because the advice changed. And so we've managed to get something redrafted, which talks about being in tier 4, and that residents must stay at home and they must not form a Christmas bubble. It is very factual. It is it's very much an instruction. There's not much fluff in that advert, but that should reach certainly a younger demographic on the digital platforms and a slightly older demographic on the actual radio platform itself. The Bracknell News, we had the general guidance advert placed in there this week for residents who buy the paper. And we also have the leaders column, which we have every week in the Bracknell News. Unfortunately, we couldn't get it into the printed edition this week because the deadline had already passed, but that is on their online edition. And Tessa Linfield was also interviewed on BBC Radio Berkshire just to help spread those messages around tier 4 and what that means for our local residents. As Charlotte's mentioned, the message is actually a lot more simple than what we were in maybe a couple of weeks ago. It is very much stay at home and do not join or form a Christmas bubble. We have strengthened the language as per the request by the last board to make sure that these are seen as instructions and not requests. And this is what people must do to keep themselves, their family and our community safe. So key messages, we have been using a mixture of the national assets that you can see on the left-hand side of the screen. And we've also been using some more localised assets as well, recognising that while we have to get the message to everybody, that not everybody will see each different asset and associate with it. So things like the Christmas turkey definition is aimed at a slightly more younger audience. And we have been mixing that up with some human communications. We've had some medics who've been speaking to camera for us, which we've released today, just trying to get that human emotion and empathy sort of angle out there a bit more widely so that people take these key messages home in a way that they understand and that they associate with. As Charlotte's mentioned, normally we do look at which audiences we're going to target for comms. Usually we look at areas whereby we need to get that message out in a much more stronger way. Previously it has been younger people, but we realised that this is spreading across the whole community, so we need to get that message out to absolutely everybody. And we've been focusing on, as Charlotte previously mentioned, focusing on people who are rule bending, who are looking for loopholes, and making them understand that this is not the time to be breaking those rules, that actually everybody needs to stick to those rules to stay at home, to not meet with their friends and family unless they're in their household or in their support bubble. But we have been providing some reassurance and some understanding type messages for people who generally don't understand the guidance and who need that support. And as previously mentioned, we have been using tougher language. We certainly sent out some information about self-isolation at the weekend, which made it very clear that that was not a request, it was a legal requirement to self-isolate if you've been asked, and that has been the theme and the tone of many of our other messages since Saturday as well. Just taking us a forward look, we will continue with the stay-at-home messages and the Christmas bubble messages over the next couple of days. And then we also have New Year to contend with in a week's time. So we'll continue with the harder languages and add New Year messages in after Christmas. There are some national assets, which you can just about see on the screen there, which we will need to adapt for Bracknell Forest, which we will get out to our community as much as we can. Our radio ad on Heart will switch to New Year messages after Christmas Day as well. And we'll make sure that we'll use all available channels where we can, and we'll use a mixture of paid for and organic reach, and we'll use traditional and digital media where we can. The problem we have with traditional media, traditional printed media, which again is not unique to Bracknell Forest, is that a lot of the messages have been changing quite quickly. So where we've been getting messages out, we've then been having to get additional messages out to correct the messages that were out previously a week before and had been correct. So while we are still trying to engage traditionally with people who don't go online, we are relying on friends and family, our community information champions, to spread those messages for us for people who we can't actually get to. That's it. That was a very quick run through of what we've been doing, but happy to take any questions.
Thank you very much indeed, Elena. Thank you. Any board member have any questions for Elena? No? Okay. Thank you very much indeed, Elena. That was very interesting, and congratulations to you and your team on responding as quickly as you did. Moving on then to agenda item 6. Do we have any questions from the public, please?
No, Chairman, there are no questions in the committee Dropbox. Thank you.
No? Okay, then fine. In which case, all that remains is for me to thank members of the board for their attendance at this meeting, and to remind everybody that our next scheduled meeting is on the 29th of December at 4 p.m. So I look forward to seeing everybody there, and I'd like to take this opportunity of wishing all the board and others that have joined us a very happy Christmas, albeit a very different Christmas, and all the very best for the new year, and look forward to